Good afternoon, everyone. This is Woody Collins with Congo Helping Hands, and we are here for another day of talking about Congo. Have a couple of interesting topics that's always interesting and that you probably should know about. Uh, we're doing these live streams daily at 3 o'clock Eastern Time, so please come back and join us at your leisure. And they will also be on Facebook and YouTube so that you can catch them there also. So, what we want to talk about today is Ebola and the COVID-19. And when I started thinking about those things, I immediately thought about what was going on here in the United States. And just as a context, here in Indiana, our governor is on the television station right now talking about our COVID-19 response and what we're doing, how we've been doing. And also, I was online with an Indian fellow who reached out to me and asked me what was going on with COVID-19. And one of the you know glaring statistics that I gave him is that we here in Indiana has had over 3,000 deaths. That's quite a bit. And when you consider the Congo and a lot of the other countries, they have not had that many deaths. Congo is sitting at 264 deaths right now that they attribute to the COVID virus. And they've had over 10,000 cases, 10,000, almost 10,400 cases that they've identified as being positive for COVID. However, that number of deaths has not been uh, like the United States. Our death rate to our um, confirmed cases is somewhere around 5% or something like that. So, it's kind of, you know, heartbreaking that we have done so poorly, and it's still, I'm just still thinking about, you would have expected in a country that like Congo, who has a low uh, access to health and measures like that, that they would be much higher. So I don't know if it's not being reported or what the case is, whether we're just doing so poorly. So, I mean, I have to point the finger at ourselves because, we see people right now that's walking around without masks on, and in that because we have this rate so high, you know, what is going on? It's just unbelievable. So, let's talk about what effect that this has had on the children. As you know, the children, they stopped going to school in March, and then they did not return. Some of the students have not returned yet. Only the students who are graduating from elementary school going into high school has went back in and taken a test. They should have finished up their test last week. Just about finished with their oral part of the exams, and then also high school students. High school students, uh, uh, those graduating high school. Uh, so, and I also looked at the university level. Some of those students are starting to go back to school. I'm not sure how they're going to treat that time period that they have did not attend to. We'll see how that works out. But the whole thing of it is that COVID has really affected the world. But Congo is also fighting Ebola. They got an outbreak of Ebola that was in the east going on, and it was just ended in the June time frame. And as soon as it was ending down, another outbreak broke out in the western part of Congo, in the northwest portion, that's closer to Kinshasa and closer, and it's on a major river, so it could easily be as people travel back and forth down the river, because that is one of the means of transportation is the river. The roads and the airplanes are very expensive to fly in the Congo, and the roads are very dangerous and far and in between. So the river makes a great mode of transportation. So those are my thoughts. The Ebola right now is at somewhere around 118 confirmed cases and about 48 deaths so far. That's the latest statistics that the World Health has put out. 118 cases with 48 deaths. As you can see, that's almost that's kind of approaching the 40, 45% that the of death rate, whereas compared to our COVID, it's way low. Even in the United States, it's only about 5 to 6%, and in Congo, it's minuscule as when you think about it. So those are the things that kind of make me go, I don't know what's going on, and it's kind of, I don't know how well that we ever know what's going on, but the thing with it is kind of someone sitting here thinking about should they go back to the Congo. They want to go, and however, uh, they don't know what the experience is going to be over there, because a lot of people, when you go over there, you're going to have to go into quarantine for 14 days. And I remember in the old days when I used to go to the Congo, before I retired and started doing this full time, I didn't go but for 2 weeks. And so that was a fast 2 weeks. You would say leave on a Friday, Saturday, and you would be back on that following Sunday, not the following Sunday, but before your 2 weeks was up. So you maybe spend, say, maybe 14 days gone. 16 days and things like that. So, now if you got to have to spend 2 weeks in quarantine, that significantly expands your trip, and also expands the amount of money that you're going to have to spend, because there in the capital city, the lodging and food is much higher than it is out in the rural areas. So those are the two things that I wanted to talk about today. Thank you again for coming by, and this is Woody Collins with Congo Helping Hands. Please send in your questions or comments to me on Facebook, email. Go to congohelpinghands.org. And my email address is wmcollins@congohelpinghands.org. And send me your questions on uh, anything about Congo. I want to have one of these sessions one day where we accumulate all the questions and talk about what you want to talk about. And finally, my final note before signing off is we're having a conference. The Presbyterians are having a conference that they had the first session today, and the next session will be October 3rd. And it's virtual sessions, and the session in October is going to be on health, and that's one of the big areas that I work in. So it'll be interesting what we're going to talk about on the health scene. And then in November there'll be some other virtual conferences on education. So think about those. Go to congopartners.org and you can sign up, and they will make sure you get the links to do that. And we had people from all around the United States at the virtual conference today, and we had people from Congo. So that was interesting and to have. And that's all through modern technology now, where some of the Congolese can get online and participate in those type things. So, as I always say, take care of yourself and your family and your loved ones. Be safe and be blessed. We thank you, and we will see you later.